Greetings, fellow Madison College employee. This is your friend Kristen Gebhardt from Human Resources, and I'm here today to talk to you about the current retirement benefits. We'll talk a little bit about the early retirement window that's coming up, and we'll also fit in what it is to be a normal retirement. So here we go. First, we want to talk about, like I said, the different retirement types that we have right now, what those benefits are for the retiree and the employee, what are those differences. Then we'll talk about some other retirement information and how do you notify. We've changed that a little bit, hopefully to make it easier for you. And then we'll go through a few frequently asked questions. So let's talk about employee benefits. Right now, employees all receive sick leave, health insurance for, now we're talking full-timers, dental insurance, life insurance, and WRS retirement benefit. We also have a voluntary vision plan, flexible spending accounts for dependent care and for health care expenses. We have a short-term and long-term disability insurance that the college pays a premium for. And we also offer tax-sheltered annuities if you would like to save further for retirement, and that comes out pre-tax out of somebody's paycheck. So now let's look at the retiree benefits. For someone who's going to retire, there is the sick leave payout that we'll talk about. There is the health and dental insurance. Life insurance, and we'll talk a little bit about that. And of course, when you retire, you're going to be looking at that monthly annuity that you will receive. What does not continue into retirement is the voluntary vision plan, nor the flexible spending account. Disability obviously stops when you're not employed as a full-time employee. And then the tax sheltered annuities, those come out payroll deduction, so those would stop as well. So the different retirement types that we have here. We have normal, and that is age 55 and above, and then we have the new definition of early retirement, which I'll go over, and then that other normal on the other end, that age 65 and above. So let's look at the age 55 normals. For full-time employees, we're talking here, you're eligible to retire as early as age 55 with 5 years, of full-time service. You will receive a sick leave payout if you have sick leave accumulated. You can also continue in the group benefit plans, those health plans and dental plans, at your own expense. There is a penalty, a WRS penalty, for retiring prior to age 65. Again, that would be dependent on your years of service and your age and all that. So that is another common term for that you'll hear in ETF is the actuarial reduction. So let's talk about the new definition of early retirement. You'll see that our favorite word of earlier is no longer around. So there's no difference in eligibility based on your employee's status as a full-time person. So either full-time faculty, full-time administrator, or PSRP. There's no differences in eligibility anymore. Those requirements right now are age 57 with 15 years full-time service, age 60 with 10 years full-time service. The notification of intent to retire needs to be received by HR between March 1st, 2015 and April 30th, 2015. I do realize that March 4th is on a Sunday, but we'll have a web form, so even if someone wanted to do that on March 1st, they could. The retirement date that someone's actually retiring from the college has to be from either between July 1st, 2015, that's the earliest day that you could designate your retirement, but no later than August 31st of 2015 to retire under these current early retirement terms. So let's talk a little bit further about the benefits. There is a sick leave payout, which has been a subject of discussion for a while now. There's that single premium for health insurance, and that is that single coverage paid until you are Medicare eligible. Normally that's age 65. There's some situations that might become earlier than age 65, but that's the normal age. And the spouse or family coverage, if you've got still a dependent under the age of 26 that you still need to cover under your plan, then you're going to take that single premium and subtract it from the family cost. But if you wanted to just cover your spouse, you would just have two single plans, one of them paid for by the college and the other one paid for by you for your spouse. Dental insurance, you can continue in that plan, again at your expense. And also on that dental, we'll talk further about it later on here, that you can purchase through singles for that as well, which is a little less expensive. Then the college assumes that cost to eliminate the WRS penalty or the actuarial reduction. So another normal retirement, the age 65 people or above. Those are, again, full-time employees, age 65, with a minimum of 5 years of full-time service at the college. You receive that sick leave payout. You can also continue in that group dental plan at your expense, so that does not end at Medicare eligibility like the health insurance does. Okay, so let's talk about sick leave. If you want to listen further on sick leave, I'm going to be doing a separate presentation on that when it comes to just how it's being changed between vested and non-vested. But as far as retirement goes, let's talk about that here. 75% of your vested sick days are paid out at retirement. And so you have a 150 days maximum. That hasn't changed, but it's as of about June 30th of 2015. So that is the amount, whatever amount you have effective June 30th of this year, is the days that we'll be calculating, and it's that 150-day max. So how is that formula calculated? So you take a look at that vested sick leave day balance again, that earned by June 30th of 15, times 75% of that. So if you have 150 days, that's 112.5 days. Then you're going to take your daily rate of pay. Again, that also is your rate of pay as of June 30th, 2015. Whatever your salary is at that day is what we'll be using to calculate the sick leave payout. Then, depending on your health insurance choice or lack thereof at retirement, it's paid to a couple different tax-sheltered accounts. And they are the Health Reimbursement Arrangement, an HRA. Eligibility for this is by defined groups because of the tax savings of these plans. You can't individually select which one you want. It has to be defined in a group. So an HRA is an account that is used for medical expenses, okay, on a tax-free basis. So this account grows tax-free. Right now, I think it's at about 2% interest as well. So you can leave it there and let it grow, or you can use it for medical expenses. Some of those include premiums so if you want to buy a spouse's premium or your dental insurance, uninsured medical expenses, anything like deductibles, co-insurance, prescriptions, all that stuff. Glasses and contacts and all that stuff too. Long-term care premiums, people have asked me a lot about that. Medicare supplements, also assisted living, nursing home, all that stuff can be used with your HRA funds. So, and that may be combined with a 403B or a special pay plan, which I'm going to also talk about next. And special pay plan is an employer-sponsored, tax-deferred 403B. Right now, it changes every year, but you can have up to $53,000 in a special pay plan per IRS. The HRA doesn't have any maximum amounts. It's tax deferred till it's withdrawn, so you're not going to be paying any taxes until you withdraw. No FICA, of course, that's a solid 7.65% savings on FICA because you're no longer employed. It's available for immediate withdrawal or rolling over. So once it's actually distributed into that plan through Mid-America, you could actually just take it out the next day and use it. You could go buy a car, or you could roll it over into another retirement plan. But again, it is earning that same amount of interest that an HRA is. So I think it's in that 2% range right now. So it's earning the same amount of interest that the HRA is. And again, like I said before, those funds can be used for any purpose. So the distribution of that, it really depends on what your health insurance is at the time of retirement. So, for example, if you're someone on WPS and you're switching to the retiree WPS plan, 100% of the sick leave is going to go into an HRA. You're on GHC and you are continuing on with that, then it's a 50-50. It's 50% HRA, 50% special pay. So I'm not going to go through the whole grid here, but you can take a look at it. If you have questions, feel free to ask me. Or anyone else on my staff. But again, if you're Medicare eligible and you're not eligible to continue in the plan, then again, that's 100% health reimbursement arrangement. There are some people that are very interested in having just 100% special pay. Really, the only way to do that, as you see on the bottom here, the very last column or last row, no Madison College health insurance at least 1 month prior to retirement. So that's pretty much telling you to drop your insurance a month before you retire if you really want it to go that way. Or you're just declining the opportunity to continue on the Madison College health plan. So you've got health insurance elsewhere. Some people are covered by the VA and don't need to continue on. That would be another way to do it. So eligibility for health insurance. Again, you're retiring with an annuity from the WRS, the Wisconsin Retirement System. You've got 5 years full-time Madison College service. You're currently in one of our health insurance groups. So for these options, you've got Group Health Cooperative, GHC, and those are the premiums there. There is not a retiree option for GHC, so if you're on GHC right now, it's the same plan you're currently on. For WPS, we have a few more options here. Again, offered for retirees who are not Medicare eligible, just like GHC. There is a lower cost option to the active employee plans. There's a few plan design differences though. That single coverage, again, is paid for by the college as part of the early retirement package. So again, depending if you're on, doesn't matter if you're on Southern Health EU or one of the statewide plans, that coverage is paid for by the college. You also have access to the Truex GHC clinic as a retiree, even on WPS, so please keep that in mind because that's another low-cost alternative for you, for other, to have you come to this clinic instead of paying co-pays and co-insurance in some of the others. So let's continue talking about WPS. There are some differences between the retiree plan and the active plan. There are higher deductibles, and that varies between the Southern Health EU and the statewide plans, and we have those comparisons out on the website. But there is no office copay for specialty like there is on the active plan, and there is not any in-network coinsurance for Southern or Health EU. So again, because the deductible is higher, it's offset by not having some of those copays. There are higher out-of-pocket maximums on the retiree plans, and the HealthSense, that wellness reimbursement is not included in the retiree plan. You can also purchase 2 single plans for you as a retiree and a spouse if you don't need the family plan. It's the same thing with GHC. So let's look at the options. We've got the premiums for WPS, and I'll just throw them on here. Again, we've got rate sheets out on the website, and some of you have already met with me or Helga Vrani about the different options, and we can hand you that rate sheet there then too, but it is out there so you can see what the costs are. So there's the different rates for all the different plans that we have through WPS. So there is a difference between the rates, and you can kind of flip between those 2 slides and see that the rates are higher on the active employee plan than they are on the retiree. I can go back once and show you that. So let's talk dental. The eligibility to remain in our group plan is pretty much the same thing here as the health. You have to retire with an annuity from WRS, 5 years full-time service at Madison College, and you're currently in our dental insurance group. And you can stay in our plan after you're Medicare eligible, so it does not end at 65. Some people have asked me, well, if I drop it now when I retire because I don't think I need it, can I ever get it back? You can. Get it back during our enrollment period in June for August 1st coverage, so you do have the option to jump back on the plan for the dental plan. It is the current plan that you're used to now. If you're on it right now, there is no difference. It's the same as our active plan, so those are the benefits. We've got a very generous dental plan, and here's the cost. So you could purchase 2 singles if you didn't need that family plan, and as you can see, the cost is less to purchase those 2 singles. So, mechanics for the health and dental. There's an early retiree benefits packet out on the college retirement website that you can, look at and select what you want to keep at retirement. You really don't have to submit that election to HR and payroll until about 30 days or a month before your retirement date. So there's not it's not something you have to give us at the time that you designate that you're going to retire. So usually about a month before. If you are paying an insurance premium either for dental or for a spouse, or if you're have to pay your own if you don't qualify for the early retirement and you're going to pay your own health insurance premium, we do require electronic transfer. So it's either the premiums are taken out of a checking or a savings every month for us to pay for that. Let's talk life insurance. Eligibility for life insurance. You do have to be obviously a WRS annuitant with 5 years of WRS service. So this is not 5 years of Madison College, it's 5 years of WRS. You're obviously currently enrolled in life insurance. So when you retire, you can continue that basic plan at your own cost. Right now, for full-time employees, the college pays 90% of the premium and the employee pays 10% of the premium for the basic plan. Once you retire, that entire amount will come out of your annuity payment. And that will continue unless you tell WRS or ETF differently. That's going to come out of your annuity check. If you are retiring before age 65 and you you're paying for additional units right now, that can also be continued at your own cost, but that does end at 65. So like I said, the premium is deducted from your WRS monthly annuity. So at 65, you have 100% coverage. Again, this is talking if you're retired. The additional units, if you keep those, they do terminate automatically at age 65. Basic coverage continues in a reduced amount. So at 65, it's a paid-for plan, but it goes to 75% of its value. Then at age 66, it goes to 50% of its value, and it stays that way. So if you had a $100,000 life insurance policy, by age 66, it's a $50,000 policy. But it's paid for, and it's there forever. Wisconsin Retirement Benefits. So they calculate, ETF calculates your benefit in two different ways, the formula calculation and the money purchase. So for formula, you're taking the average of the 3 highest years, those are fiscal years, and they're using a multiplier for your years of service, and coming up with an annuity amount. Money purchase, they're kind of taking a look at the amount that you have on your statements that you get on an annual basis, and looking again, they are looking at your age and years of service, but they're going to say, okay, what can we purchase an annuity at the market rate right now? You're going to automatically, by state law, receive the highest of those two methods. So again, when we're talking about the actual reduction, that only comes into play under the formula benefit, just to keep that in mind. If someone's higher on the money purchase, there is no penalty. I'd say the majority, 90% of people I talk to, is normally their benefits higher under the formula calculation. Wisconsin Retirement System. There is an awesome benefit program section on the ETF website that goes over a lot of this stuff. There's some videos that probably is more exciting than mine that can talk about all those different annuity options. Those of you that have received the estimate in the mail, you can see there's about 7 different options, and sometimes you just need someone to explain that to you. They do talk about that. You can also do a calculator, a retirement benefits calculator on the ETF website that'll kind of give you an estimate of what your retirement would be. Takes a little bit of work on your part to input the numbers, but it works pretty slick. So check out the ETF website and look at all of that. And I would also encourage you to call ETF to get a retirement estimate so that you can have a better idea of what your annuity would be. And if you are a qualifier for early retirement, I would also tell you to tell them that the college pays the WRS penalty or the actual reduction, and then maybe they could work that into the estimate. Other info that you might need: check into Social Security, look at your annual statement, and then request a full statement of your account. Those of you that are faculty, certification, at least right now as it stands, you may need to renew if you plan on coming back after that 75 days, but be very, very careful not to commit to anything until after that time. ETF is really cracking down on that and paying a lot more attention to it than they have in the past. And there's still a Madison College Retirees Association. They're very active, and I believe their meetings are still the first Monday of the month, and they have an annual meeting in September. So, notification of retirement. For those people who are in the normal category, between either 55 and above and 65 and above, we're requiring a 60-day notice, and we will have a web form available very soon. For the retirement dates, it varies a little bit, but by full-time group. So faculty, they can retire at the end of a semester. PSRP, there's no date restriction there. And admin would prefer it's the end of the first semester or the end of your contract, which is June 30th of every year. If you have questions on different dates, you'll need to come and talk to us to see what can be worked out. But those are the two that are preferred and are fairly standard. For those of you who are doing an early retirement, there is a notification period between March 1st and April 30th of 2015. And like I said, that web form will be available by then. And the retirement date to receive the benefits that I just talked about is between July 1st and August 31st of 2015. So that has to be your WRS retirement date as well. It has to match. So whatever you tell ETF, that's the date, that's your last day here as well. So the application form available mid-February. I'm trying to get it out there, but I don't want people filling it out yet. So if I have a little bit of a problem with that, you might not see it until closer to March 1st. But we have a bunch more information out on this link here on the Preparing to Retire webpage. So questions, again, like I said, Preparing to Retire webpage, it'll tell you there if you could send your questions to retirement@madisoncollege.edu. Then there's more than just me answering those questions. I'm not as fast lately answering my emails. And again, looking at those dates for early retirement, we'll get everything going. And this recording is obviously you're listening to it, so it's out on the webpage. So, my notification, how do I initiate that? Beginning March 1st, as I said, a web form is going to be available on the web page. And another question that I'm sure would come up for some people, can I rescind my retirement notification? And yes, you'll have 30 days from the notification date to rescind. So, so the date that you put in your retirement is when the 30-day clock starts. So here's some questions that people have been asking. What other leaves are paid out at retirement? PSRP receive their vacation balance payout in July. Anything that they have earned but not used is paid out. So if you retired after July or July 1st on, yes, the 15-16 vacation would be paid out. Administrators, if you've worked more days in your contract than was in your contract, you're going to get paid for those non-contract days. And then faculty, there aren't any leave payouts per se, except for, of course, the sick leave for everybody. Can I retire on a non-work day? Yes, the retirement date can be different from the last day worked. This comes into play a lot of times with our PSRP, who might have a lot of vacation to use and say, my last working day is, July 2nd, but my actual retirement date is August 30th because I have that much vacation to use. And yes, you can do that, but you please need to let us know that so we get that correct. Can I change my health insurance plan after retirement? You still can do that during our dual choice period, though, in June. So that's when we have our enrollment period. It's in June for August 1st coverage. So keep that in mind. You can't do it just at the time of retirement unless you're switching within the WPS plans, like going from the active plan to the retiree plan. What if I don't want my sick leave payout to go towards the HRA, the health reimbursement arrangement? You do need to refer to our sick leave grid to look at that, because as I said before, there can't be individual choice there. It has to be group selection, which is why that grid exists. So some other resources, again, go on out to the ETF website. You can request that retirement estimate like I talked about before. I think there's a form you can actually fill out on the web, but if you really want them to work in that actual reduction, you may want to give them a call. It's just that do something else while you're waiting, because you can be on hold for a while. In HR, myself, Kristen, and then Helga Vrani are available. And also Lisa Lanting is another person. Just by osmosis, she can answer a lot of these questions too. And then our payroll department, between John View and Lori Pop, they can probably help you out as well. Otherwise, emailing your questions, if you could email those to retirement@madisoncollege.edu. And that's all. So thank you for putting up with this, and hopefully that helped answer a lot of your questions. Thanks.